My name's Tasha Pruitt. I am a manager of talent acquisition at CVS Health Minute Clinic, and I'm here to give you some tips and tricks on how to build your resume and how to prepare for your provider interview. So, what are 3 things you can do to improve your resume as a provider? So, one is you want to tailor your resume to fit the job description. Pick out keywords like chronic care management, Epic experience, primary care. These are going to all really highlight why you are the perfect fit for that job. The other is you want to highlight your specialized skills or certifications. Really showcase these skills and why it makes you a good fit for that job. This could be DEA license, DOT certification, telehealth, EMR, and things such as that. The other is you want to quantify your impact. So we want numbers here, not words. So instead of I usually do this or I always do that, think of a specific example, such as I reduced patient wait times by 30% by streamlining triage and intake protocols. That will really help your hiring manager see how you improved care efficiently and positive outcomes. So, what's one thing that you should avoid when building or updating your provider resume? So you want to avoid vague and generic language. It weakens your resume and makes you really blend in instead of stand out. So this is important because first impressions in an initial resume review is critical. Generic phrases don't communicate your actual value or skills, so you want to be clear about what you did, how you did it, and the impact you made. So what are 3 ways to improve your interview skills as a provider? So one is you want to prepare and rehearse STAR format. We're familiar with this as nurses when we're reporting off to physicians. This is the same format we use in interviews. It's going to be like, give me an example of a specific time when. So for STAR format, you have situation, task, action, response. So you're going to use that same format with your interview. The other is you want to research the employer and ask smart questions. So look up the employer, look up their clinic and their patient population. Prepare 2 or 3 really thoughtful questions that show you did your homework. How are providers involved in patient care? Or how long does onboarding take? It really shows that you have a vested interest in the interview process. The other is you want to practice communicating with confidence and clarity. So speak clearly and concisely. You want to record yourself answering questions and make sure you pull out filler words such as and like. Avoid rambling and unclear answers. Really make sure you avoid lack of eye contact, even in a virtual interview. Very important. And you want to work on your tone and presence. Be calm, assertive, and empathetic. So, what is the best way to prepare for your interview as a provider? So one of the biggest things is to know your role and the employer. So understanding the setting helps you tailor your answers and show you're a perfect fit. So practice with mock interviews. Practice with a peer, a mentor, or a family member and record yourself. Next, you want to make sure you dress professionally. This is even for virtual interviews. Make sure you have the dress code that matches what the job will look for. The other is follow-up. It's always a nice idea to send a thank you email afterwards, really reinforcing your interest. So what's one thing you should avoid during a provider interview? So one thing to avoid is speaking negatively about past employers or experiences. Why is this a problem? Well, it can make you seem unprofessional. It can make you seem bitter or difficult to work with. Even if you have valid frustrations, interviews are not the place to air those out. So what do you do instead? You want to stay neutral and professional. If asked why you're leaving a job, focus on growth, goals, or alignment, not complaints.